expand Medicaid, you'll take away the funding that they already get for Medicaid. But you can incentivize them. So that's what ended up happening. So, no state is obligated to expand Medicaid. And as to make the long story short, our Governor Jean Brewer, Jan, thank you, Jan, already declared in the State of the State address that she wants to expand Medicaid in Arizona. Now it has to go through the political to the legislative process. Some committee or she would have to write a bill, submit it for voting, and then when that happens, I am not kidding you, we'll be in Univision announcing it. Why is that important? Listen to this. The current Medicaid program will cover children through kids camp, pregnant women, and people that have dependent children. But if you do not have a dependent child, you don't qualify. By expanding access in Arizona, that group will be able to get health insurance. Basically, for free. Because access is basically insurance for free. So there's a lot. So now, let me paint the scenario and finish. I'm going to finish already, believe it or not. You have very little income, potentially you will qualify for access. You have a little bit more income and you don't qualify. Oh, let me say that 100 to 138% of federal poverty level is what's going to qualify you for access. 100 to 138% of federal poverty level. So, let me go back. So you have a little bit, yes?
No, I'm just, you go ahead with your thought and then I can ask.
No, I'll pick it up.
What is going to happen, or is in there somewhere for the working poor?
That's what I'm addressing. Income, right? If you meet the eligibility requirement, 100 to 138% of federal poverty level, you will qualify for
But
access.
usually the working poor don't qualify for the access.
Why not?
Because they make maybe $100 more than.
Okay, then they would have to get it from the exchange.
Oh, okay.
And they will get tax credit or a subsidy to help them get the insurance. So that's what I was kind of painting the picture. We have access, the current access program will cover children, then pregnant women, then older folks that have dependent children. With the expansion of Medicaid, if the governor is successful in getting it expanded, then childless adults will qualify. But if the income is a little higher, then they have to buy it from the exchange and get the tax credit. And then there's going to be a huge group of us who are going to get our insurance through our employers. Do you have insurance? Okay? And that's how, look at the picture. Look at the picture. I was just amazed at how the whole landscape of insurance is kind of completing the cycle or the circle for coverage for pretty much everyone. Did I paint that picture? Based on income, you qualify for something, and then you may have your employer insurance. Yes.
Okay. Right now, what happens, and I'm talking about a lot of single adult mental health disability disabled people. So they qualify for disability, they get tossed off of access, and they don't qualify for Medicare for 2 years. So for 2 years, they're without insurance. What's going to happen with them? Is there anything for them?
At this point, I would still have to say that the income limits would apply to them as well. I am not aware of any different arrangements for them. It's all going to be the income. Do you qualify for the current access program? You'll get it. Do you not, but you qualify for the expansion of access, then you get it from the expansion of access. You don't qualify because of your income, then you have to go to the exchange. And if I am understanding these things right, and I think I am, the exchange is going to be a website that is going to steer the ship for you. You're going to be able to input information, and the system is going to tell you what you qualify for. And most likely, you're going to be able to apply. Well, definitely, you will be able to apply for whatever insurance. Because even today, my wife and I, we help people to, whenever they have questions with access, don't ask me for my phone number. And, you know, you can do it online, even access. So eventually, the internet will be it. And there's going to be obviously still phone numbers and materials for those that don't have access to internet. You know what? I feel very good. I will stop here. I think I have painted somewhat of a picture for you of the healthcare law, and I hope I made some things clear. Why don't we just take a few more minutes if you have any comments or questions. I accept comments. I like comments. And you can criticize me too. I'll take that as constructive criticism.
So if you have let's say you have a group plan for a lawyer, would it be allowed for you to go look at the exchange and maybe the exchange plans are better than what your employer offers?
Yes, you can do that. You will be able to move to the exchange if that's better for you.
Just a question on access part. Say hypothetically, if Arizona gets the expansion, are there going to be any modifications, under access? Because maybe any modifications on access or Medicaid?
I don't believe so. I think at this point the eligibility is what's changing. At this point, that's what I have as information.
Whose surveillance is that?
Huh?
Whose surveillance is the people that are receiving access? Whose surveillance is the people that are receiving?
That the Health and Human Services Department under our state government. Yeah. Yes.
So David, I think all of us have heard so much controversy, and you touched on all the good points. Tell us some of the bad points.
There isn't any.
Oh, no.
The bumps on the road.
The bumps on the road.
Remember, we try to get the politics out of these things to try to make a little sense of it, because if not, we would be boxing right now. There's a lot of politics involved. And a lot of the things that you have heard are politics. And you and I have the responsibility to be able to discern what's politics and what is not. Don't get too caliente. Right? So, what have I heard? How are we going to pay for it? That's a genuine concern, I would think. Now, what's the answer? Well, the Affordable Care Act in the law says how they're going to pay for it. They have everything said that will it happen? Don't ask me. All I can say is that in the law, they already gave you the projections of the cost and how they're going to pay for it. They're projections. They're there in the law. But I'm not going to bet my life on whether that's going to happen or not. But you know what I'm saying? It's just like anything. When a bill is written, everyone has to write in it that it's going to be paid for. But, I mean, I'm not going to say it will or it won't. It's in the law, the way it's going to be paid for. Another thing is, that's socialized medicine. That's another kind of criticism. And then it's very interesting that some people say, I don't want government intervention in my, but they don't realize that's what Medicare is. So see, Medicare is government, access is government, pretty much Social Security is government. So there's just concepts, and again, it is our responsibility as adults to discern what's politics.
Financial loans is government.
Oh, I think you raised your hand first.
I had a question about the organization of the exchange. I'm aware that Arizona did not choose, or Governor Brewer deferred the essential benefit development to the federal government. In other words, there was a big analysis that they did at the state to say whether or not we should build our own exchange or whether or not we should let the federal government do it. And what happened was Governor Brewer said, thanks, but no thanks, Arizona. The federal government
Right.
will do our exchange.
Right.
Do you have any information about what that means for what our own essential benefit, what our base plan would be on a federal exchange? Because in Arizona, I think it was to have been comparable to one of the big commercial plans here in Arizona. I think Aetna was supposed to have been our model plan if we would have chosen. Do you know anything about
What
that?
I can tell you is that it will not make a lot of difference as to the actual product, the premiums and all that. Doesn't matter who run it. And you are right, our governor decided not to implement the exchange or the new marketplace. I don't believe it's gonna make a lot of difference in the product and in the premium system and all that.
Does that mean that the Access Administration though will still be the holder and the bearer of?
I don't think so, not for the exchange unless they, look, and I wouldn't doubt, I don't think I have this fact correctly, but do you know who was one of the, what state was one of the last to implement Access?
Okay, Arizona.
Arizona. What does that mean? That it can happen down the road. Right now, the way things are, Arizona says, no, we're not implementing, but it can happen that can change in the future. They may open a window for states that change their mind, and that could happen. But it's either going to be implemented by the state or the federal, but the principles of the exchange, they're going to be the same. It's not going to be, we're not going to feel the difference, regardless of who establishes the system.
I just wanted you to just mention the reason that this law was put into place as far as the debt and the percentage of debt that health care is to our federal budget.
Again, what I can say, and I can only say a little bit on that, is that there is some criticism that it didn't address the main drivers of the cost. But if you, the more you read, and we encourage you to read our publications, there are some drivers that are supposed to bring the cost down, and there's an estimate that it'll save, and I don't have the right figure in my mind right now, but many billions of dollars over 10 years that is supposed to save. It's supposed to save. Okay?
And it has to do with preventive care. So that's why they have all these elements in the law, because we all know that if we take care of ourselves and we prevent problems, it's not going to be as costly on the other side. Right now, we're addressing the acute rather than the prevention. So that's how we have to look at it.
Yes. Yeah.
Can you talk about the federally qualified health centers?
The what?
The federally qualified health centers, their role in this?
Okay, what are those again?
Community health centers?
Okay, there are some investments. There are some investments in the Affordable Care Act. I thought I read this even this morning. I think it's like $11 billion that are going to be given to community centers in rural areas for clinics to be expanded and offer more services, because we are very aware that rural areas have some issues with healthcare. So they are addressing some of that already, and I wouldn't doubt that they'll continue to address and improve the system with more options there. Yeah.
This might be outside of the scope of your talk, but will physicians and mainly physicians still be able to opt out of Medicare, not accept Medicare patients?
The federal law doesn't touch that aspect, and a doctor is free to do that. There's nothing prohibiting a doctor that says, you know what, forget it, I don't like how Medicare pays me, I'm out of here. They can do that. They can do that.
So are they still gonna have the 1,800 different insurance companies that they have to deal with, and co-pays and
all that sort of stuff.
Yes.
So wouldn't it have been better to look at like a single payer kind of?
That is not in the law. Whether that's something that can happen in the future, who knows? But at this point, that is not the law. Yeah. We will not have a single payer system.
That would really raise the state.
Now, yes.
Oh, I just want to make sure before you finish that you talk about your train-the-trainer program, your community educators program.
Okay, anybody who wants to help us to do what I just did, but I know you will do it better. Remember, I'm just doing it because nobody else is doing it. Not that I'm an expert, I already told you I'm not. But I've been running a community educators program statewide. Like I told you, I returned from Yuma last evening. And then when I was driving back, I got a phone call from our national office that learned about my program. Now they want to learn about it. Because I think I had the foresight to start this thing way early. And I'm already like, how many of you have seen me in Univision or Telemundo, at least one? Yeah. They have me as a person who can speak on this issue, so whenever something happens, and I sometimes trigger them. I'll send them an email and say, did you know that our governor announced that people, oh yeah, come. So I happily come, because I'm sure you already can tell that I love to speak. Well, what I do, let me tell you, this program was supposed to be a Hispanic outreach program, because I'm a director for multicultural outreach. Well, I currently have 200 people on my roster, and only about 15% are Hispanics. And 85%, 85 are non-Hispanics. This morning, I did a practice session on Medicare via Skype. A lady from Prescott is ready to go on Medicare. We train them first on Medicare, then on Affordable Care Act, and then on Social Security. Then this morning, I also went to our office in Peoria to have 3 persons. One did a practice sessions, and for 2 others was a trainer. My view of this is that this is here to stay. This is not going to go away, so I hope that I can have at least 1 or 2 persons in every corner of Arizona. That's my hope. Every corner, from Douglas to San Luis, every corner. Have 1 or 2 people who can speak on these issues. I'll stay in touch with them via email. We'll have conferences. I'll go to your place, we'll train, and we'll keep educating ourselves and spreading the word so that we eliminate ignorance or lack of knowledge. Is that the same thing? Look, a lot of people are afraid of these issues. I have noticed. I'm not afraid of them anymore. You know how much time I spent preparing for this evening before I came? Nothing. I don't prepare for these things anymore because I've been speaking of them for so long now. Medicare, oh, I love Medicare. Ooh, can we have a presentation on the 2 options of Medicare? Part A, Part B, Part D, Part C, the deductibles, the co-payments, the out-of-pocket, the Medigap insurance, the retiree insurance. I'm telling you, it's really good. And listen, you save money. I saved my parents $1,000 just for knowing Medicare. In their choices, they save $1,000 a year. So it makes a difference. So if anybody wants my business card, this is my business card. Take a flyer so you can kind of know what we're doing, and then my number and my email is there. If you feel like you want to join our program or have any ideas or have a group, a church that you want me to go speak to, I'll be glad to do that. So take a flyer. Yes.
Do you have a listing anywhere where you will be talking on Medicare?
At this point, I do not, and I tell you why. Because not all the places are public. And I don't have the freedom to invite people to non-public events. But I am scheduled to speak tomorrow on the Affordable Care Act at the Mustang Library in Scottsdale. And I'll be at the Madison, a senior group in Sun City on Monday. And then I'm going to have a conference in San Luis on the 3 issues in Spanish in April 18th. So there's all kinds of things going on, and this is only one man. Can you imagine if we had an army of people who are willing to learn this thing?